So the Delta variant has reached our shores, and many of our fellow Jamaicans are still unvaccinated. Apparently, not apparently, it's been in 7 parishes. I said this morning, I wondered, and it's in St. Elizabeth, Manchester, Clarendon, St. Anne, Kingston, and St. Andrew. Join us this morning to shed some light on the Delta variant is immunologist Dr. Johan White. Good morning, Dr. White. Welcome to Smile Jamaica. It's morning time.
Morning.
Hi. Good morning to you both. Thanks for having me. Good
Hope,
morning to your viewers.
yeah, man. Hope all is well with you, sir. What is a variant? So explain to me that there's a coronavirus, right? Which is, and then we heard of COVID-19. So is this something different from COVID-19, different from the coronavirus? What is a variant when you say that?
Right. Excellent question. So the COVID-19 refers to the disease, so the symptoms that you have as a result of the infection with the novel coronavirus. Not so novel anymore. It's called SARS-CoV-2. So it started out with the original strain of the virus that started in China and was spreading across the globe. And now it has picked up changes. So as the virus gets transmitted from one person to the next, it has mutations or changes in its genetic makeup that gives it certain advantages, such as making it more easily transmitted from person to person, or makes it last longer in the environment. So any change that results in an advantage to the virus, that's usually how it emerges. So the more it's transmitted or allowed to be transmitted, the greater the opportunity for new variants to develop. So changes that give the virus an advantage.
Yeah. Oftentimes when we hear about Delta, Dr. White, people say it is more contagious than previous variants. It's more ruthless. Do we know why? Do we know why that's so?
Yes, so it's, when these variants have changes, it's usually in the spike protein. There's a little latch, if you will, on the surface of the virus, which is like a globe, and it uses this to stick to the cells in your body to cause an infection. So these variants usually have an enhanced ability to latch on to the cell and cause an infection. So it's more easily spread from one person to the next because it's easier for it to latch on to your body and to the cells in your body. And in fact, Delta is far more easily spread than the original strain of the virus that's causing this pandemic. In some estimates, it's twice as infectious, so twice as likely to be spread from one person to the next. So with the original virus, if you were in a room and somebody was 6 feet from you and they sneezed, with the original variant, physical distance might have reduced the odds significantly of you getting it. But with Delta now, you probably are twice as likely to get it. So it's far more infectious. And in some estimates, in some parts of the world, estimates put it at 5 to even 10 times more easily spread from one person to the next. And the problem with that is that more people become infected and then more people get hospitalized, not necessarily because the virus is more serious or causes more serious disease, although with Delta, there's some suggestion that it may be causing more severe disease, but that is not clear as yet, and we're not sure if it's more fatal. But for sure, if more people are becoming infected, then more people become hospitalized. The health system becomes overwhelmed, including people who are seeking medical care for other issues. So delivery for pregnant persons, people who need surgery, people who meet in motor vehicle accidents, they're displaced and their service is delayed because the doctors and nurses and medical staff are paying attention to patients with COVID-19. So it's really, really important to prevent yourself from becoming infected and from ending up in hospital.
Yeah, you mentioned physical distance just now. Is the Delta passed the same way from one person to the other? Is the same way it's passed as if COVID-19?
That has been an evolving conversation. There are many ways that this virus can be spread. It can be spread from somebody coughing or sneezing or touching a surface and leaving it there, and somebody comes and touches that, from coughing and the droplets being suspended in the air, because a sick person or a symptomatic or infected person may be in a room, they're there alone, they have the mask off, they cough, they're talking on the phone. and they're leaving droplets, and they may go out the room and somebody may enter that room, and it's enough to, if you're inhaling all of that, for you to become infected. So there's a variety of ways through droplets, sneezing, coughing, it's in the air suspended. So you really do have to be careful. It reinforces hand washing frequently, cleaning areas that are highly touched, and wearing your mask at all times.
Yeah. Um, is the vaccine, therefore, even more now an option with Delta around, Johan? Are we saying you really need to be vaccinated because this variant, not joking?
Yes, and that's such an important question, Delia, because with the original virus, we estimated the herd immunity. So this is the proportion of the population that needs to be immune to kind of stop this pandemic in its tracks. And we've been talking about 60%.
Right.
But with a more easily spread virus, it moves that target up, and it could be upwards of 80% or so, right? So it becomes even more critical for wider proportion of the population to become vaccinated and for vaccination to be rolled out much faster, because the people that we're seeing in hospitals who are not doing well are those who have not yet been vaccinated primarily. Mm-hmm. And yes, being vaccinated is not 100% effective in protecting you from infection, but if you're vaccinated, those persons tend to harbor less virus in the airway. It lasts for a shorter time. They're less likely to end up in hospital, less likely to die, less likely to spread it, even though there's still some risk of spread, which is why we still enforce mask wearing. The vaccines are, especially a couple of them, are showing less effectiveness against the Delta variant, but it's still largely good at preventing people from hospitalization. But when you look in the laboratory, it may not attack the virus as efficiently as
some others.
Right.
I have a couple more questions. One is, you mentioned the vaccine, but before that, even before I heard Delta in the United States, I heard booster shots. Even before I heard Delta, I then hear Delta and I hear booster shots. Does that mean that we need booster shots even before this variant? And you already said it, what we've got so far doesn't cover you 100%. Right. So do we need booster shots? And is it every year we're going to have to do this, or what?
Right. I'm in the influenza research area as well. And like the flu, most scientists and physicians really anticipated that at some point we will need boosters. We weren't sure exactly when, 1 year, 2 years afterwards, not sure. But what we're seeing in some countries is that the loss of protection is so significant, especially in persons over 60 years or persons who are immunocompromised, so weakened immune system, that they definitely will need or benefit from an additional shot or an additional vaccination, immunization dose. But persons who are immunocompromised, we know that the original regimen of 2 doses, for example, was never enough to even get them initially protected. And so persons with heart disease, kidney disease, uncontrolled HIV, certain medical conditions that weaken the immune system, they really need a 3rd shot to complete their primary protection. That's even before talking about booster. And then for the rest of us who were vaccinated at some point, either a year after, at some point we will definitely benefit from having an additional dose. But right now, we need to vaccinate as many people as possible. Countries who are hoarding the vaccines, rich countries that are holding on to the vaccines, some of them are expiring, really unethical. And I don't know how we can advocate more strongly for them to do the right thing and allow access to vaccines in the developing world where people are dying thousands a day.
Yep. Final question from me, Dr. White. And you mentioned, and you said some of the vaccines seem to be not as strong as some. I think that's what you said. Correct me if you didn't say that. But what's the difference with the vaccines? I ask that because even now in the United States, they have not certified the one that we get here in Jamaica, the AstraZeneca. Right. Isn't it the same things in all of these vaccines and just different manufacturers, or do they have different things in them and we don't know what's going on?
They have different things. So the ones that came out first, Pfizer and Moderna, they have a little um, piece of instruction in the vaccine that when it goes into your body, allows your body to make things that elicit an immune response to protect it. And other vaccines like AstraZeneca, it has that instruction, but it's delivered in a different way. So we use small, harmless carrier viruses. So these are common viruses that would have probably caused a common cold or something like that. That's not so, widely distributed that you can still use it in a vaccine. So they use different technologies. And then in China, China's made at least 2 vaccines that actually use the whole virus, but they kill it. So when you put the inactivated virus into the body, it triggers your immune system to make a protective response to protect you from future infection. And sometimes to the different vaccines, even if they're the same principle, there may be other things in it that we call adjuvants or other agents that help the vaccine to work a certain way. And each vaccine company may have its proprietary kind of formulation that they would not share with anybody else. So you don't really know what that instruction is. But so far, Pfizer seems to be the one that is losing ground in terms of its efficacy, at least in the laboratory. But in the UK, we're seeing that after 2 doses, still 84% effective in preventing hospitalization.
Yeah.
Delia, sorry, Delia. Delia has a question, but in addition to that, and you can't think for them, obviously, but why would the United States not certify the AstraZeneca?
There are many factors. You have to recognize that the ones that are approved are major US companies. Moderna is a collaborative between the National Institutes of Health and a US entity. AstraZeneca is a UK vaccine. So there's politics, there's all of that stuff going on.
Got my answer.
My final question for you, Dr. White. I mean, initially when we heard of the coronavirus, a lot was being said about seniors and about comorbidities, but we're seeing more and more young people, getting COVID and dying from COVID. And I read this morning somewhere that the Delta is particularly deadly to young people. From what we've learned so far, is this now what we need to understand, that it affects everyone and not just seniors?
Definitely. It's a number of factors that come into play. We had initially prioritized the elderly and persons of a certain age for vaccination. So they have some protection, whereas young people were not being vaccinated. But young people are moving about more. The virus is also changing and it's more infectious, and we see people in large gatherings at events. So they're putting themselves at risk. And yes, there seems to be an underlying biological factor where it seems to be causing more severe symptoms and disease in young persons. So definitely concerning.
Yep. I did say final question. Forgive me, sir. And obviously there are many skeptics out there. A lot of people don't want to take the vaccination. Is there any other way that you can protect yourself, whether by the way you live, how you eat, outside of being vaccinated?
Vaccination is going to be one of our main tools through this pandemic. This pandemic doesn't appear to be going anywhere, and we are in this for the long haul. Vaccination is important, but even with immunization, it's going to be important to wear your mask still, because you can still transmit and you can still encounter persons who are vulnerable. They have weakened immune system, the elderly. Remembering that the elderly, even though they're protected by these vaccines, in the vaccination world, take flu, for example, the dose that we need to give to the elderly usually is a 4-fold higher dose than young people would normally get. And we haven't really been doing that for the COVID vaccines, which is probably why you see them losing protective efficacy. The aging of the immune system, or something that we call immune senescence, is something that contributes to a weakened immune system. And we need to factor that into immunization. So alongside immunization, there's hand washing, there's masking up, there's avoiding gatherings, and physical distancing that are still going to be critical to get us through this pandemic.
Thank you, sir. Which would suggest if we're not vaccinated, this is going to spread. Thanks a lot, sir. God bless you. And thank you for what you've been doing for all of us. Dr. Johan White, immunologist.
All right, coming up next, we take our latest book off the shelf.